By definition, aerobic exercise targets your cardiovascular system, which consists of your heart, lungs, and blood vessels. It increases your heart rate and breathing rate by working large muscle groups and improves your body's ability to deliver and use oxygen for energy. Aerobic exercise has lots of positive effects. Here are some more potential benefits for individuals with COPD who include aerobic exercise. Better performance of daily living. Lower blood pressure and improved blood vessel flexibility. Reduced number of lung flare-ups. Improved mucus clearance and production. Reduced body fat and maintained healthy weight. It's important to know how often, how much, and for how long you should be doing aerobic exercise in order to notice a difference. We call this the FIT principle, which stands for frequency or how often, intensity or how hard, time or how long, and type or what kind. It's a scientific approach with recommended guidelines that have shown great health benefits for people with COPD. Let's take a more detailed look at the FIT principle. Frequency. For maximum benefit, in addition to your regular daily activities, you should do aerobic exercise a minimum of 3 times per week. Intensity. The effort of your exercise is determined by how short a breath you feel or how tired your legs feel. This graph represents exercise intensity. It uses a scale from 0 to 10, with 0 meaning you have no shortness of breath and your legs feel perfectly normal, and 10 being the most intense shortness of breath you could ever imagine, or when your legs feel the most tired you could imagine. When you are doing aerobic exercise, you should maintain a rating of 3 to 5. This is when your shortness of breath is generally moderate, but may get a little more severe as you get towards the end of your workouts. A simple and practical way to measure how you are doing is a talk test. At low intensity, you should be able to say a full sentence like "Happy birthday" to you without pausing. At a moderate intensity, it should be more challenging to say the sentence and you may have to pause once or twice. At high intensity, you may have to pause at every word or even in the middle of words. Remember, your goal is to reach a moderate intensity. Time. You should aim to exercise for 20 minutes. As you become more fit, add a few minutes to your workout until you reach a total of 30 minutes. If it's easier, you can break up your workouts into 5, 10, or 15-minute sections and try to do 2 to 3 throughout the day. Type. Choose activities you enjoy doing, like walking, swimming, cycling, or even climbing your stairs counts. It's common when exercising to feel slightly short of breath. However, if your shortness of breath is getting worse, you can use pursed lip breathing to help you catch your breath. Inhale for 2 counts, and then purse your lips as if you were going to whistle, and exhale slowly for 4 counts. Continue to breathe like this until your shortness of breath has gone. You can also stop exercising, but continue to use pursed lip breathing. Once you catch your breath, continue on with your exercise. Before starting your exercise routine, it is important to warm up your body. We want to increase your heart rate and blood flow to your muscles nice and slowly. Aim to do this quick warm-up every time before getting started. Let's try this together. It is also important to do a cool down after your exercise. Stretching is a great way to cool down and keeps your muscles from becoming too tight. Here are some stretches for you to try at the end of your exercise.